We're just learning this. The FDA has approved a Johnson & Johnson vaccine booster. The agency unanimously approved the vote and recommended getting the booster shot for certain groups 2 months after getting their first shot. Now, remember, Johnson & Johnson is a single dose at the outset. Yesterday, the same panel voted to recommend the Moderna booster shot. That one would be given 6 months after the second dose to anyone 65 and older or at a high risk from underlying conditions. Meantime, LA County has already administered about 270,000 Pfizer booster shots. So if you are waiting on Moderna or Johnson booster, you're going to be able to get it. We're joined now by Dr. Nicholas Testa. He's the Chief Medical Officer with Dignity Health Southern California. Let's just get your first reaction to that news about the booster shots.
So, Phil, it's a one more step forward, which we like to see. But I want to caution everybody, there's still one level of approval that needs to occur, which it needs to go to the CDC. And I anticipate that they will also approve it. But I also want to remind everybody that just because it's approved, it's only approved for a subset of individuals, right? Those who are at high risk based on age and those who work or live in high risk locations. We still do not know if boosters are going to be approved for the general population. And there's some debate still in the literature as to whether we should approve boosters for the general population.
And let's not forget, and I've actually heard President Biden say this, and I would assume you would echo this, we really still need to focus on getting everybody vaccinated that's unvaccinated. We somehow need to get those folks over the hump as well.
100%. The focus needs to be on using the resources that we have to vaccinate those that are unvaccinated. If you were to visit any one of our hospitals, the vast majority of patients, 95+% who are being admitted through this fourth COVID surge, are unvaccinated.
And that is a daunting statistic when you think about it. Okay. Now, we don't want to only talk about vaccine. We want to look back a little bit because during the pandemic, a lot of women put off screenings, mammograms. Doctors have raised concerns about diagnoses that were possibly delayed. So is that getting better? Are more women starting to reschedule, or are people still worried about going into a hospital?
So great topic to discuss during Breast Cancer Awareness Month. So what we saw from March 2020 to right around August for about 6 months is we saw a curtailing of all elective procedures. Those include diagnostic screenings like mammograms. Now, what is good is that it took us about 6 months for healthcare systems to really say, okay, we're going to deal with COVID, but we got to get back to doing this routine screening. It's life savings. So we're back at it. And right now, patients are able to get their screening in a safe environment. We've been able to do that for the better part of a year now. What we've seen, though, in the literature is that for patients from that March to August, we're seeing an increase in mortality and morbidity. So we need to pivot back and really focus on those patients who we missed screening in that period of time. So it's incumbent on us as healthcare delivery systems to reach out to those patients, but it's also incumbent on those patients to say, hey, I missed my mammogram because of COVID. I got to make sure I get in there and get it done this year, or follow up with my doctor.
I know it's a technical term calling it elective, but it's really not. I mean, it's imperative. Maybe, and it's so important. What would you say to people, because you can't go in pairs when you go to the hospital. I mean, if you're going, you kind of have to go do your thing by yourself, right? Mm-hmm. So we should encourage, go still forward.
No, go forward. Whatever support system you need, do it. The truth is, many of us, screening for medical stuff isn't something that we want to take the day off to do, but think about your family, the loved ones that rely on you, and the benefit of being able to diagnose something early. I just think it's one of those health maintenance things that as we all get older, we don't like to admit that we're getting older, that we just need to accept that we're going to do, and do it for yourself, but do it for your loved ones too.
I kind of laugh when somebody doesn't like getting older because the option is much worse. Not getting older is a lot worse.
I like that.
Okay, let's talk about Halloween because, last year was remarkably different. What would you say to folks who are thinking, do we go out, do we trick or treat? How do we do it? What do you say when it comes to that? Because we are in a different world than we were a year ago.
Sure. So Halloween is on this year. I mean, we full on canceled Halloween last year, but we are going to have Halloween this year, and kids can go trick or treating with a but in there, right? but we're going to do it a little bit differently because now in this post-COVID world, we're going to do everything a little bit differently. So we're going to try and keep it outside as much as possible. We're going to wear masks. And just because we have like a fun costume mask does not mean that protects us. We need a 2-ply mask over our mouth while we're trick-or-treating. We want to keep social distancing. We want to, and this is an important one, as far as handing out candy goes, we want to hand it out physically. No big buckets and to cauldrons to pull stuff out of, right? We give it to the kids and we do good prep for it, right? So we wash our own hands, right? To make sure we don't ever transmit anything. And then we limit the number of houses we go to, and we try and limit the number of people we trick or treat with, right? So it's great that we're back, but let's keep it to just a few close family or friends that we know and interact with on a regular basis.
Okay. Dr. Testa, happy Halloween in the future when it gets here. But thank you very much for joining us from Dignity Health, Southern California.
Thank you, Phil, and boo to you.
Always appreciate it. Okay.